Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Surgery, focusing on neurosurgery. Let's get started with question number 1. For the following case, which of the following is the most likely diagnosis? A. Autosomal dominant polycystic kidney disease. B. Autosomal recessive polycystic kidney disease. C. Lindau syndrome. D. Neurofibromatosis type 2. E. Von Hippel-Lindau disease. The case scenario is: a 26-year-old man comes to the office for follow-up related to painless progressive visual loss in the right eye. Recent ophthalmological evaluation revealed macular edema due to 2 retinal lesions consistent with capillary hemangioblastoma. He underwent laser photocoagulation treatment, and the vision in his right eye has improved. The patient has no other medical conditions. His father died from a cerebral hemorrhage at age 52. MRI of the brain with gadolinium reveals 2 small, cystic, enhancing nodules in the cerebellum. Renal ultrasonography reveals multiple cysts in both kidneys. The question is: which of the following is the most likely diagnosis? Your options are: A. Autosomal dominant polycystic kidney disease. B. Autosomal recessive polycystic kidney disease. C. Lindau syndrome. D. Neurofibromatosis type 2. E. Von Hippel-Lindau disease. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is von Hippel-Lindau disease. This question is designed with the focus to assess your ability to apply foundational science concepts. This patient has evidence of von Hippel-Lindau disease, an autosomal dominant disorder that results in benign and malignant multiorgan tumors. The most common tumors associated with von Hippel-Lindau are hemangioblastomas of the central nervous system, particularly in the cerebellum, with a classic cystic nodular radiographic appearance, and retina. Although the tumors are non-invasive, symptoms occur due to hemorrhage or compression of surrounding tissues. Bleeding from retinal tumors can lead to retinal exudates and impaired vision or, if untreated, retinal detachment with vision loss. Acute hemorrhage in a brain tumor can result in herniation and death, as likely occurred in this patient's father. Malignant manifestations include renal cell carcinoma, which occurs in more than 70% of patients by age 60. Renal cell carcinomas are of the clear cell subtype and typically bilateral. They are often preceded by the formation of multiple renal cysts, which are considered a pre-malignant condition. Pheochromocytomas also occur with increased frequency and are characterized by paroxysms of hypertension, tachycardia, and diaphoresis. Less common manifestations include vascular tumors of the endolymphatic sac in the ear and pancreatic disease, like cysts and neuroendocrine tumors. Genetic testing for germline mutations is key to diagnosis. Management requires frequent tumor surveillance beginning in infancy or early childhood. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. Choice A cannot be the answer because autosomal dominant polycystic kidney disease also manifests as CNS and renal disease. However, the CNS disease is largely due to aneurysms, which would not appear as cystic nodules on imaging, rather than tumors. The renal disease is characterized by progressive parenchymal obliteration by cysts, which commonly leads to flank pain and hematuria, and the condition is not associated with retinal capillary hemangioblastoma. Choice B cannot be the answer because patients with autosomal recessive polycystic kidney disease are typically diagnosed in infancy or childhood. Although the disease is associated with multiple renal cysts, patients characteristically develop end-stage renal disease in early childhood, and hepatobiliary involvement is common, like hepatic fibrosis and liver cysts. But it is not associated with hemangioblastomas. Choice C cannot be the answer because Lindau syndrome is an autosomal dominant disorder associated with alterations of the tumor protein p53 gene. It usually results in early onset of malignancies such as sarcomas, breast cancer, and adrenal carcinomas. CNS disease is characterized by gliomas and medulloblastomas, not hemangiomas. Choice D cannot be the answer because neurofibromatosis type 2 is another autosomal dominant disorder with marked CNS and ophthalmologic features. However, it is more commonly characterized by CNS schwannomas, particularly of the vestibular nerve, and meningiomas. Cataracts and retinal hamartomas are also common ophthalmic manifestations. Your take-home message from this question is that Von Hippel-Lindau disease is an autosomal dominant disorder resulting in benign and malignant multi-organ tumors. The most common tumors are hemangioblastomas of the central nervous system and retina. Other common manifestations include renal cell carcinoma, often preceded by the formation of premalignant renal cysts, and pheochromocytoma. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the Usmle, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.